Remember, California's 58 counties, over 470, almost 480 cities. And when we talk about our state, we talk about scale and size and scope that is equivalent to 21 states' populations combined. So it's trying to reconcile our challenge, but also trying to reconcile the differentiation in regions, large and small, all across the state, became a big frame of focus and engagement at the local level. As a consequence of that, we started to socialize the term localism is determinative, meaning local conditions are such that local electeds, local health directors have a unique understanding of the criteria of concern, also the criteria to which they would afford a remedy to those concerns as it relates to the spread and the transmission of this virus. We started to see density of transmission in certain parts of the state. Other parts of the state just didn't experience any real transmission. We saw deaths increasing in certain parts of the state. We did not see that in other parts of the state. Many counties, many regions asserted themselves, understandably, making that point that they're different from other parts of the state. And we began the process of what we refer to as attestations. And these were locally directed attestations, attesting to certain criteria, certain responsibilities, certain procedures and plans that would be put into place through a technical engagement with the state of California that would allow certain parts of the state to open a little bit more quickly than other parts of the state if, in partnership with the state of California, they attested to being prepared and being accountable and responsible for the transmission of this disease. You recall at the time we talked about making sure that part of that attestation includes making sure you have adequate testing, making sure you have adequate capacity to begin the process of contact tracing, making sure you have appropriate levels of PPE, personal protective equipment, not just face masks, but gowns and gloves and the like. We also had responsibility within the hospital system to make sure that they could address possible need for a surge, and that include not just hospital space, but also prospects that they have enough ventilators and ICU capacity as well. We also had a framework of focus on homelessness, on issues related to seniors in our skilled nursing facilities and our residential care facilities, as well as people in congregate facilities, locked facilities, county jails, adult correction facilities, and the like. Butte County was the first county to move forward with an attestation, and we started our phased approach to reopen the economy here in the state of California. We talked in terms of 4 phases. We have been clear through the attestation process that we will allow counties to move forward on their own time through 3 phases, not the 4th phase. And I'll remind you that 4th phase is large-scale festivals, outdoor facilities and concerts, rather, facilities like convention facilities and the like, large events, for example, sporting events. That's all in that 4th phase, and no part of the state of California is allowed, even through that attestation process, to move in to that 4th phase. But people are pacing in and through phase 2 and phase 3. We had, at last count, last week, we had over 52, and then we went to 54 counties that have gone through this attestation. We highlighted one county that was interested in moving forward to the attestation phase, Imperial County, but was simply unable to attest that the conditions were such that they can mitigate the spread of the virus and also protect their citizens if indeed there was a surge. On Friday, I highlighted Imperial County as an example of a county that not only did not move forward with an additional attestation, but needed, we believe, and continue to believe, needed to move back. That despite the fact that they were not able to attest to go in deeper into this phase 3, they were able to open some parts of their economy. But even so, the spread of the virus in Imperial County was such that we as a state were working with that county to decompress their hospital system. Over a 5-week period, just a 5-week period, we had to move 500 patients out of their hospital system into surrounding county systems, putting a lot of stress and strain on the surrounding systems, but also only reinforcing the imperative to address the conditions in Imperial County and address why the spread was continuing at such an extraordinary pace. And when I mean extraordinary pace, we had positivity rates. Remember, positivity rates, number of people tested, percentage of people tested that test positive, positivity rate. We had positivity rates in Imperial County as high as 23%. And that raised red flags. And over the course of many, many weeks, we've been supporting our technical assistance teams have been sent down there, federal, state, regional teams, including just this weekend, where we sent down 3 of our cabinet secretaries to meet with representatives and to only reinforce our support to address the conditions in the county. We encouraged the county on Friday to begin to phase back, to use what we referred to over the course of the last few months as the dimmer switch. We talk about these attestations, but they also have a dimmer component as well. What you attest to is also your capacity to toggle back, to dim the reopening, to move back into a place where we can mitigate the spread. And that's exactly what we are requesting of Imperial County. Their formal County Board of Supervisors will be meeting today and tomorrow in making that determination. If they are unsuccessful in building consensus around going back into a stay-at-home order frame, the state of California will assert itself and make sure that happens. Accordingly, and I highlight Imperial as we did on Friday, just to underscore the unique characteristics and conditions that persist and exist throughout the state of California. But there are also many other parts of the state that we are monitoring. In a moment, I'll get to some slides and show you more specifically the number of counties that we are currently monitoring and what that monitoring looks like. Dr. Ghaly will come up and talk a little bit more specifically about what the criteria and conditions are to end up on this monitoring list, this watch list, and then work we will do as a state to begin, again, to use that dimmer switch as we are suggesting and ultimately require in Imperial County. By the way, that's exactly what we did over the weekend. On Sunday, recognizing the transmission has increased in areas of the state, not just in Imperial County, we moved forward to require 6 additional counties to, for example, toggle back and use that dimmer switch by closing down bars in order to slow the spread of the virus. We also recommended yesterday, Sunday, that 8 other counties consider doing the same. We, as I said, are working very closely and collaborative with Imperial County because we believe they need to move back into that stay-at-home posture. The bottom line is we're doing this because we have seen an increase in the spread of this virus. We've been very clear, and this shouldn't surprise anybody watching, as you reopen the economy, as we move away and make the meaningful modifications which we did to our stay-at-home order, you're going to see people mixing that otherwise were not mixing in the past. Many people were not necessarily being as responsible as they otherwise, as we would like them to be as it relates to practicing physical distancing, social distancing, people that weren't wearing their face masks. That's why a week plus ago we required mandatory face coverings, face masks in the state of California and help mitigate the spread. We need to take further steps, and that's exactly what we did this weekend on Sunday by closing down some of the areas of concern. When we talked to health officials up and down the state. One of the areas of concerns was bars in particular. Other areas I can get into, like family gatherings, which is something we all should be very, very cognizant of, particularly as we move in to 4th of July weekend. We'll talk more about that over the course of the next few days and our concern from the health perspective of people mixing, extended family, and other people coming together and congregating that otherwise are letting their guard down a little bit and mixing. That is also one of the reasons we're seeing an increase in the total number of positive cases in the state. But we start with bars in these counties, and we have 8 counties, as I said, on top of those that we have mandated the closure, that we recommend the closure. Let me tell you the criteria we put forth for the bars. That's 14 days where we have seen these counties on the watch list, and that becomes the criteria. Once over a 2-week period, and you're still on that watch list, and we're still seeing an increase in spread and transmission, that then triggers the kind of decision that we made yesterday. The 8 counties that we're recommending, those are on a watch list, but just 3 to 14 days. None exceed the 14 days on the watch list, but none are less than 3 days. And we're encouraging, working in partnership with the health officials in those counties to consider similar guidance, and to the extent that they choose otherwise after a 14-day period, we'll assess that and we will make the determination, our health team, as to whether or not we will ultimately make that decision for them. So that's the recent weekend actions. The Friday announcement, if you didn't have a chance to tune in on that, around Imperial County and the supports we're providing that county, and obviously now the actions we've taken as it relates to the bars. But let me now show you why that's the case. Here's the case numbers from Friday. 5,932 new cases on Friday. Saturday, 4,810. And of course, you see the Sunday numbers. This is the latest reporting period, 5,307 cases. That represents, over a 7-day period, if I went back and provided you another slide just to give you a sense, a 7-day snapshot, in the last 7 days, we've seen a 45% increase in the total number of cases that have tested positive in the state of California. There are a couple reasons why that's the case, and this slide is an important slide to underscore that. Again, forgive me, I've repeated this many times, showed this slide on many occasions, but it's an important slide. The first 14-day cohort of positivity rate in the state of California that we recorded showed 40.8% of people that were tested positive. The last 14-day period, we are now at 5.5% positivity rate. But you see on this graph, those of you that are watching, not just listening, on this graph, a significant increase in the blue lines here. The blue lines represent the total number of tests in the state of California, from less than just a few thousand in April to a record number yesterday. Just shy of 106,000 tests were conducted yesterday. So again, we expect when you test over 100,000 people in just a 24-hour period, you're likely going to see more people test positive. But not only are we seeing that, which is represented in that 45% increase over the last week in total number of positive cases, but the positivity rate is particularly concerning, and this is why we are monitoring it very, very closely. And let me give you another slide here to see more specifically the concern. Just a couple weeks ago, we were at 4.4% positivity. And you recall, the reason we started to reopen our economy is we saw the positivity rate remain very, very stable. Number of hospitalizations and ICUs for many, many weeks, arguably a few months, was incredibly stable. And just in the last few weeks, you're starting to see, when you take a closer look at the positivity rate, an increase that raised the concerns that led to the decisions we made on Friday in Imperial County, led to the decisions we made over the weekend as it relates to shutting down bars in many counties in this state. 5.5% is of concern. It's not where some other states that are generating headlines are. They're substantially higher, but we don't like the trend line. And that's why, again, this mandatory mask requirement is in effect, and that's why, unfortunately, we're using this dimmer switch to start to pull back on the stay-at-home order. By the way, that 5.5% masks, forgive me, but it does mask the 7-day trend, which is at 5.9%. So 5.5, you see here in this chart, is the 14-day. Just the last 7 days, we're up to 5.9% positivity. As it relates to hospitalizations, not surprisingly, accordingly, you're seeing hospitalizations increasing in the state just over the last 2 weeks. Hospitalizations have increased by roughly 43%, 43% in the last 2 weeks. You'll see, though, here, in terms of our total capacity as a system, our capacity absorbed this. And I just want, again, to take a moment. All of these months, when we did the stay-at-home order, we didn't sit on our hands. We worked aggressively, not only to engage with our county health officials, as I noted at the top of my remarks, but also to engage them with purpose and intention, and that is to really assess what our needs are in this state to work our way through the first wave of this pandemic. And remember, we're in the first wave, and then to prepare for a second wave, which many experts believe will come later into the fall. That included making sure we had a healthcare delivery system that included alternative care sites, included hospital beds, and plans, protocols, and procedures to significantly increase our capacity within and around the system, not only in terms of physical capacity, but also human capacity. We had this team referred to as the Health Corps. We identified personnel and appropriate protective gear and worked to really build out a robust framework for our planning purposes. In this slide, you'll see reflected our current capacity as it relates to hospital beds in the state, just shy of 75,000 hospital beds in the state of California, 73,867 to be precise. And by the way, that number changes on any given day for a myriad of different reasons. We currently have, you saw from the previous slide, represented 4,776 individuals that are COVID-19 positive cases. So that represents about 7% of the total hospital system capacity. Also referenced on this slide is the total number of admitted patients, just across the spectrum of patients that are in the hospital system, which is currently about 58% of total capacity. So you get a sense here, 30+ thousand or so bed capacity that we have in this state, just within the hospital system alone. In addition to this, we have the protocols, plannings, and the processes that we are able to turn on these alternative, we call FMS sites, these federal medical station sites, and these other alternative care sites, which we have talked about over the course of the last many months that we have procured and identified all up and down the state. Seton Hospital in Daly City as one example, the Arco Arena, Sleep Train Arena up here in Sacramento. All these are examples of those alternative care sites that have now capacity, and we could turn them on in pretty short order. ICU admissions, again, we focus on positivity rate. We focus on hospitalizations. We also focus on ICU admissions. You can see, not surprisingly, hospitalizations went up 43%, ICUs tracking with about 37% increase over the course of the last few weeks. You'll see on this slide that represents about 13% of the entire ICU capacity in the state of California, though currently a lot of ICU beds are being utilized for non-COVID-19 patients. If you just look at the total number of beds available today as a snapshot, we are utilizing about 39% of that capacity of available beds are represented, rather, in the total number of COVID-19 patient cohort. If I confused you, let me step back and say that again. Total number of ICU positive patients versus the total number of ICU beds in the state is 13% are now COVID positive of our ICU capacities. But of the available ICU beds, roughly 39% have been absorbed because of COVID-19 positive patients. So it gives you a sense of the capacity we have in our system that will allow us to work our way through and manage the increase in the transmission of this virus, including, by the way, the ventilators that are available today, over 11,577 ventilators that are available today for use as part of our critical care capacity. So numbers are going up, but our ability to manage and absorb also is significant. And so I just want to, for the purposes of full disclosure, tell you the challenges, but also tell you what we have done to meet those challenges head on, in addition to try to mitigate the spread so that you see less blue on this pie chart and more orange moving forward. As it relates again to the approach, I'll repeat, it is a dimmer switch. Diverse cities, diverse counties, different parts of the state experiencing different challenges for different reasons. Let me, well, in a moment, Dr. Galley will come up and explain, rather than me, what those different reasons are. You may see increases in certain counties, maybe primarily because of spread that exists, for example, in a state prison, other parts of the state in a federal prison, and that increases the total number of cases in a county. Others have more generic community spread, which is just people mixing and not, in every case, wearing face coverings and not practicing the social distancing. Each county, different conditions. So when you look at the numbers, you have to get in under the hood on why those numbers are increasing. And again, that's the approach. There's a more sophisticated approach than we have time to express or explain here today. But approach is a dimmer switch, and that approach is different in each county. Final words from me until I ask Dr. Galley to come back up. As I've said on multiple occasions, we monitor daily, county by county, the conditions on this dashboard, and we're making that dashboard public. We announced last week some of the efforts to truly be as transparent as we possibly can be in terms of our modeling approaches and in terms of providing you real-time look at where your county, where your community may be. So we're actively monitoring all 58 counties in the state of California, but we're now targeting our monitoring in 19 counties. And by the way, when we went into the weekend, on Sunday we had 15 counties we were monitoring. We added 4 more counties today. We added Solano County, we added Merced County, we added Orange County, and we added Glenn County to the targeted engagement list. So now we're 19 counties, and Dr. Galley will attest, now that represents about 72% of the population in the state of California. 72% of the population represented in 19 counties that have targeted engagement with our state health officials. And as you see from the slide reference here, again, 7 of those counties we are now adopting this dimmer in terms of their reopening. But with that, let me now bring up Dr. Galley to explain this slide in terms of what local conditions mean and how they drive our response. And I'll come back up, finish up, and of course, answer any questions. Dr. Galley?
Thank you, Governor. Good afternoon. I wanted to remind you a bit about how we are looking at our support and work with various counties around ensuring that their epidemiology, that is really just to say the data that we're watching closely around cases and availability of things like hospitalizations and limited hospital capacity in order to ensure that counties have the level of support they need to manage spread, and then to think about, as the governor discussed, the ability to further dim or go back with certain sectors. So just to remind you, we're watching closely elevated disease transmission. So what does that mean? That we want no more than 25 cases per 100,000 people in a county reported as a case over a 14-day period. We're also looking at a test positivity rate less than 8% over the 14-day period. So as the governor is discussing the overall climb across the state from the mid 4% to the mid 5% over 14 days of test positivity. We're looking at that county by county as well. We also want to know that we have increasing hospitalization or have enough space in our hospitals. So watching very closely each county's census, that is the number of people with COVID positive diagnoses in hospital beds. So ensuring that that 3-day overall average of the number of COVID positive hospitalized patients is no more than 10%, signifying when it crosses that 10% threshold that day over day, many, many more COVID positive patients are needing hospitalizations. And then connected to that is ultimately our ability to care for people in the hospitals. When we see less than 20% of ICU beds are available in a county, or that less than 25% of the total ventilators a county has are available, we get concerned. And that's what helps us look at counties and basically places them on the county monitoring list so we can begin that targeted engagement. As the governor said, in California, a state this size with this many people, we're really experiencing COVID-19 in quite different ways across the state. Sort of looking at 3 different counties, starting in the north with Sacramento County, where we are here. With our close work with Sacramento County leaders, they have identified that family gatherings, getting together with family members, maybe outside, probably inside, not following some of the guidance around face coverings, staying socially distanced, likely led to outbreaks within families that led to the rise in cases and then the rise in hospitalizations that we're seeing in Sacramento County. An over 40% rise in hospitalizations over 3 days in Sacramento County alone. Moving further south to San Bernardino County, a different story. This one due to local jail outbreaks, SNFs, skilled nursing facility outbreaks, as well as community spread. This sort of hybrid scenario in San Bernardino has had that county experience quite a significant rise in cases. And then looking at Imperial County again, we sent an entire team of senior leaders down again this weekend to augment that ongoing work that the governor highlighted last Friday of the engagement with Imperial County, and really looking closely not just at the border with Mexico, but also the border with Arizona, understanding how factories and farms play into disease transmission, and then how that spills over into community transmission, similar to what we see in Sacramento County within households and at family gatherings. So again, emphasizing that each county, each part of the state needs a different solution to getting control of COVID-19 spread. And our team at the state, working closely with officials at the county level, are crafting those solutions and determining what can be done in advance to recommending and even requiring moving back. To continue on that theme, we look at this in 3 progressive areas in terms of enforcement and effective community action. We're looking to help support counties in stabilizing their data as the first category. This is emphasizing education and public awareness, ensuring that our messaging is reaching those populations that are experiencing the highest rates, those most vulnerable, and then looking to pause any further new sector opening. Once a county moves to the next level of concern, we start doing things like you saw over the weekend, right? Closing a specific sector, looking at what sort of additional technical assistance and support we can provide a county, looking at those sectors that close, understanding what they might do differently when they reopen again, and then establishing strike teams at the state, not only in Health and Human Services through the Department of Public Health, but inviting a wide array of agencies and departments to support those counties in improving those conditions so we can avoid moving into what we think is the alarming rate of spread, where we, of course, continue all of the things we were doing initially, but then we look very closely with elected officials, health officers, at considering requiring a return to stay-at-home order. And the only county so far As a result of the really high rates of test positivity, the number of patients and people we were moving out of the local hospital system into the regional and statewide hospital system out of Imperial, we're asking them to return to the stay-at-home order today. So with that, I'm going to turn it back over to the governor. Thank you.
Thank you, Dr. Ghaly. So bottom line, and we've reinforced this on many, many occasions, there's different transmission dynamics that persist and exist in every part of the state. What Dr. Ghaly was referring to as it relates to that differentiation is also a recognition that the critical need to mitigate this transmission also requires enforcement. And it is incumbent upon all of us to do what we can to lead by example as individuals by wearing face coverings when we can't practice physical distancing, social distancing, but also as business leaders to protect not only your workers, but to protect your customers. We will be stepping up our enforcement in the state of California. There's many mechanisms to which you can enforce. At a state level, there's some tools. At the local level, there are even more tools. Again, locally, that enforcement is driven by decisions, the county health officers, by elected representatives. At the state level, we made comments last week, and I'll reinforce them here today, in relationship to the budget that I'll be signing later this afternoon that stipulates $2.5 billion of COVID-19 related and realignment related dollars to the counties that will stipulate certification as it relates to capacity to enforce these health orders. It is incumbent upon all of us in the state of California to take seriously these rules and these regulations and to enforce them. And I want to just encourage our partners, and they have been incredible partners up and down the state of California, to do justice and to help us mitigate the spread and the transmission of COVID-19 by enforcing these rules and regulations, not punitively. Again, it's not a ready, fire, aim approach. It's a ready, aim, fire, meaning we want to work with people and be responsive and responsible to help support their needs, particularly small businesses. I deeply understand that, intimately understand that as a former small business person. Help educate on the rules and procedures, but moreover, remind people. We put out over 30 sectoral guidelines in the state of California that lay out how to safely reopen. We've been so fixated, and I cannot impress upon folks this point more. We've been so fixated on the when, not as responsibly focused on the how to safely reopen.